Can you tell me what the Movement Disorder Clinic is all about?
The Movement Disorder Clinic is a joint Vancouver Coastal Health and UBC clinic. It's probably the largest Parkinson's clinic in Western Canada. It's deemed an international center of excellence by the US-based Parkinson's Foundation. We try and provide comprehensive care, which includes not only medical input, but nursing input, allied health personnel, including physiotherapy, occupational therapy, speech-language pathology, and social work. And we have a very active research program where we're performing research not only to find an ultimate cure, but also to find ways to ease the burden of people living with Parkinson's.
Yeah, in the time that you've been here, what changes have you seen?
I've noticed a number of changes. Specifically, there's been greater support now for allied health personnel. I think that's being due to a number of reasons. Some of it is through generous support of charitable organizations such as the Parkinson's Society of BC, the US-based Parkinson's Foundation, and also the Pacific Parkinson's Research Institute. And so I think that's been a very big benefit for people living with the disease. I think worldwide there's a greater recognition that the best way to deal with this disease is a multidisciplinary clinic. Mm-hmm. There's good evidence that people who are taken care of in a multidisciplinary environment tend to do much better. And so I think that's definitely the way forward. And so I'm delighted to see that we now have better allied health support.
I saw on the website that there's, like, you had, well, according to 2019 statistics, over 1,200 people come in to see the clinic. As well, there's already about 1,100 people that were already involved with the clinic. So, how do you manage all?
Well, we've certainly recruited a number of new physicians. Probably about 10 or 15 years ago, there were just 3 or 4 of us, and it was extremely busy. A number of people, the number of new people that we see with Parkinson's has increased dramatically. That's probably due to a number of factors, some that more people are moving to the Lower Mainland, but also there's some suggestion that the incidence of Parkinson's is increasing dramatically. So we've fortunately been able to recruit some very skilled clinicians, and so I think the throughput, i.e. the number of people that we see with the disease, has increased dramatically over the last decade or so.
Yeah, so like for me, back when I first found out I had Parkinson's, I met you, and I remember one of my first questions was, Michael J. Fox said at that time, a cure would be 5 to 10 years away, but you told me realistically 10 to 20 years. Are we still getting on that, or you think it's still further away?
Well, I think it depends what you mean by a cure. Like, will there be a magic bullet where you can take a pill and it would cure the disease? I'm not sure how realistic that is. I think what might be more realistic is something like diabetes, where people used to die from diabetes, and now with the discovery of insulin, people manage their diabetes. The same with things like heart disease. People now manage their heart disease. So I think whether or not there'll be a magic bullet, I think it's obviously worthwhile to continue chasing that dream and to work hard towards it. But I think in the interim, we also have to focus on mitigating some of the complications of the disease and trying to minimize the symptoms while we get towards the ultimate cure.
Yeah, for me, I'd just be happy if it stopped progressing. Yeah. So, have you heard or do you know of any studies that suggest that could be possible?
Well, still by far the best evidence is for exercise. We still don't understand what type of exercise is best, but it's clear. There's clear evidence that the more active you are, the slower the disease progresses. There may be some medications that slow the disease. That's a bit of a controversial aspect to that. There's a lot of interest now in the gut. We think that the disease may actually start in the gut. So this raises the possibility that if we can modify diet or use probiotics, that this may actually influence the progression of the disease. And in fact, there may be gender bases for that, in that it seems that diet seems to affect women's the progression in women more than it affects men. Yeah.
Wow. How about any kind of natural type of solutions?
Well, we're very open to looking at, I guess, non-conventional treatments. One of the things that we've always found fascinating, like as I said, when we do research, the first thing we do is we speak to experienced clinicians who've met many, many people with the disease and get their intuition. And one of the things that we found very interesting is when we ask people, when do you feel your best? A lot of people would say, after I do meditation or I do yoga or I do Qigong or Tai Chi, I feel great. And then unfortunately about 20, 30 minutes later, we go back to baseline. So the big question is can we harness that? There was something in that seems to be helpful. And so I do think that there's an area of biofeedback, which might be a natural way to see if that could be used to sort of harness the brain rhythms, which is kind of the basis in which the deep brain stimulation works, which is a proven therapy. It doesn't really modulate the biochemistry, which is what the pills do. It modulates the brain rhythms.
Yeah.
So if there's some way you could modulate the brain rhythms through meditation or some sort of biofeedback, that might be a natural way to move forward.
That's really interesting because personally I do an active chant, and so that's always helped me with my voice, kept it strong. Yeah, and the other effects are just benefits too, just like I feel much more alive and happier. So.
Well, the other interesting clue is that excuse me, is sometimes when the brain rhythms of sleep may act as a little bit like an endogenous deep brain stimulation. So sometimes people will talk in their sleep, and what's always been a bit of a mystery is that people may have a soft voice with Parkinson's during the day, but when they talk in their sleep, their voice is normal.
Yeah.
Or they may be slow during the day with their Parkinson's, but when they move in their dreams, they move normally. So this has always been a bit of a clue, is how is this possible? And it may be that the brain rhythms of sleep are kind of resetting the brain rhythms in a positive way. So I think another area that's going to be an area of active growth is looking at the role of sleep. And we do know that sleep is affected negatively in Parkinson's, and so if we can improve that, there may be some areas where we can improve aspects of the disease. So.
Yeah, I noticed after getting my deep brain stimulation surgery that my sleep was much better. Yeah, it was the first time I slept like 9 hours, and I just felt so good after. Yeah, so that's been a huge benefit for me, being able to sleep again. Yeah.
The other thing that's kind of interesting about the deep brain stimulation, which is a bit of a clue, is a lot of people report that their bladder issues have improved after deep brain stimulation. And so again, this is a common complaint that we see is people have issues with bladder urgency, and sometimes that settles down after deep brain stimulation, so that might be another clue. That brings up another area that we're looking at, which is non-invasive neuromodulation. So is there any way we could put electrodes outside the brain as opposed to putting an electrode deep inside the brain to get anywhere near the same benefit of deep brain stimulation? And this is this whole field of non-invasive neuromodulation, which I think is going to be a growing area. So,
weren't you doing a study on ultrasound? Yeah.
Yeah. So there's many areas that are that ultrasound is found to be effective. One is that one of the older surgeries that was used for Parkinson's, particularly for tremor, was to go in and make a nick in the area of the brain where the tremor originates. It is now possible, and this is being done in Toronto and Calgary and other places in the world, where they can focus ultrasound beams and just heat up that part of the brain very carefully And that can essentially, it's a bit like Star Trek, where you can do an operation without having to cut inside the head. So that's one area, but that's kind of a lesion approach. Another area where people are looking at is where you can actually give a medication in little bubbles, microbubbles that are in the blood, and then you can focus ultrasound, and what it does is it loosens the blood-brain barrier so that the bubbles, which might contain a special medicine, gets released in one part of the brain. So that's another area. But a third area, which is an area we're just starting to explore, is that if you vibrate the brain very gently, you can actually cause part of the brain to fire, and so you can activate the brain.
Oh, wow.
And so this is a very, very new area, but a very exciting area because one of the things with special ultrasound machines, you can actually activate particular areas of the brain. And if there's some areas in the brain that are underactive due to Parkinson's, we might be able to sort of reactivate them in this way. So this is something that we're currently investigating. So.
Well, it sounds really exciting, all these ideas that are coming up. So you must have a great day every day, because it sounds exciting. You make it sound so exciting.
Well, it certainly is exciting. I mean, it is very rewarding working with the Parkinson's population. They're just, in general, I just find a wonderful group of people, very supportive of research, very supportive of our efforts. So it's very exciting. There's lots of things happening and lots of challenges as well. I mean, the brain is the most complicated thing in the universe, so we nowhere near understand enough of it, but it presents challenges, but it certainly is very exciting looking at all the things that we can try and do to help the lives of people living with Parkinson's.
Yeah, really appreciate everything that you've done for me so far.
Oh,
yeah,
thank you.
Yeah. I think one of the things that I tell people in regards to medication, that follow it strictly as your doctor prescribed, because for me that delayed the delayed dyskinesia quite a while. Like I think I went 10 years without it getting really bad, right? And then after that it got worse. But like for the first 10 years I thought, wow, I'm doing pretty good. Yeah. So that's why I tell people, follow your prescription religiously, because if you don't, you could have dyskinesia quite easily. So.
Yeah, I think one of the biggest challenges of managing people with some of the symptoms of Parkinson's is that it's so variable from people to people. And if you speak to, your neighbor whose cousin had Parkinson's, what worked for them may not work for you. And every person is different, and it's the sort of extreme heterogeneity of the disease that makes it challenging. So, and then the other issue, of course, is if the doctor thinks you're taking the pills at 8 a.m. and noon, and you're actually taking them at 9 and 11, then they can't make the right decisions because they're not working on an accurate assessment of what the situation is. So
so I think that's really important that that patients follow what they've been prescribed. Anything else you'd like to share?
Well, one of the things that we're kind of interested in is not only monitoring people with the disease. So the big challenge is, of course, is that unfortunately we're so busy that we may only be able to see someone every 6 months or even every year, and that's clearly inadequate. So I think we're exploring technologies where we might be able to monitor people remotely and in their home. Not just over Zoom, but if we could assess someone's motor performance with video technology. Of course, this has to be done very carefully with preservation of privacy and so on, but we think there's ways that we can deal with that is to everyone's satisfaction. The other thing that we want to do is we're very interested in is so-called smart pill boxes. So people may think that they're taking the medicine at 8, but if they're actually taking it at 7, so it'd be nice to have a pill box that would record that automatically. So not only would we have when people are taking the medication, we would also have a continuous assessment of their motor performance. And then I have a feeling that if we kind of were able to optimize that, we would see much better outcomes with regards to complications of the disease like dyskinesias and so on.
What about like having some kind of app within a smartphone, a smartwatch?
Yeah, Well, that is one thing, and I think compliance is a bit of an issue. I don't think people would be comfortable wearing up 10 different sensors all over their body. They might be able to wear a smartwatch, but I'm just not sure that the smartwatch is necessarily going to give you enough information. It might give you some information, and there's certainly a lot of groups that are working on that. We're kind of going the video route because we think that there may be other things that might be very important, like facial expression, for example. There's a study that just came out in China where they argue they can diagnose Parkinson's by just taking a picture of your face. And so I think being able to monitor facial expression, that would help give you an insight into emotions and so on. And also eye movements seem to be very important. That may be predictive of falls, so the videos can sometimes capture eye movements. So we're interested in looking at that.
So would that mean like a little app with eyeglasses or something?
Maybe, or with cameras now we can digitally zoom in. So if you had one or two cameras in your living room, and the technology is smart enough that it can zoom in, and if you have a visitor visiting you in your home, you want to be monitoring you, the patient, not your visitor who doesn't have Parkinson's. So you still need the full resolution to be able to do the facial recognition. And as I said, there's technologies now that enable us to kind of focus in on a particular area. So.
Yeah, cool. That's really cool. I don't have anything else to ask, but just on a personal level, what would you like to see happen in terms of like for the movement disorder as well as for yourself and your goal towards a cure?
One of the things that we're actively looking at is this neuromodulation. So we're electrically stimulating the brain externally. That requires a lot of fancy analysis. So there's a lot of interest in sort of big data approaches where we can use fancy analytics. And I think what we're going to see in the future is that better ways to sort of customize the treatment. So for example, with the deep brain stimulation, right now it's basically one size fits all. And that may not be the best approach. The other area that's very hot is this idea of so-called closed loop stimulation. So right now with DBS, the stimulator is pretty well giving the same stimulus all the time. But if someone's active, you might need more stimulation, and if you're relaxing and watching TV, you might need less stimulation. So the ability to sort of ramp up and ramp down the stimulation, depending on the activity of, of the individual, that's the type of thing that might be very effective. So.
Yeah, I have a friend that's actually involved in a study that's related to that.
Great.
Yeah, so his deep brain stimulation has that. Suppose it has that function. So.
Oh yeah.
Yeah. So it's pretty cool. Yeah. Well, thank you for your time. Yeah, I really appreciate it.
Very welcome.
Yeah, thank you. So, if you could tell me what's your particular area of specialty with the movement disorder clinic?
I'm the social worker in the clinic. I've been here for almost 15 years, and it brings with it a lot of exciting opportunities to work with people with Parkinson's and their families.
And what actually do you do as a social worker for people with Parkinson's?
Really good question, because oftentimes people have a very limited scope of a scope of what the social worker does. And sometimes when I'm introduced to a patient or a family member, they think kind of two things. One, that I don't have any financial issues, so why are they bringing in the social worker? So that idea that social work is just about financial issues. And the other being that there must be something really seriously wrong, because otherwise why would they bring the social worker in?
Yeah.
So those are two things that I do help out with, but that's just one piece of it. So with people with Parkinson's and their families in our clinic, I really work to provide education, information, support, counseling, referrals, to help them understand, adjust, and manage to the physical, the social, the emotional, and the practical concerns that can arise from diagnosis through to end of life.
Wow. Have you had cases where people who just find out, are in disbelief, and how have you helped them?
So somebody who's newly diagnosed
yeah.
and is having a hard time coming to terms with that.
Yeah.
Yes, absolutely. I do get involved but really it starts with meeting the person where they're at,
okay.
because not everybody wants to talk. Not everybody wants to read up on it.
Yeah.
Some people need a couple of months just to kind of be with it by themselves. So we really just try to let them know that these resources on our team are available and that they can tap into us as they need. It's not tied to the doctor's visit, but they can reach out at any time.
Yeah. For me, I didn't reach out to you at first because I didn't really know what your sources were, right? So until I actually got involved, it helped me out a lot.
And I think even still people don't know when I say kind of social or emotional or practical concerns. Sometimes it's helpful to articulate that a little bit. So it's, dealing with loss and grief associated with the condition and the diagnosis, or anxiety or depression, all of those kinds of emotions that can happen, again, for the person with Parkinson's, but also for the family members as well, because Parkinson's disease is a family affair. It doesn't just affect the person with Parkinson's, it impacts everybody.
I think that's something that people don't realize, that it's not just the person that's suffering.
It impacts everybody. So I work with care partners alone. I work with adult children. I work with younger children, so for the young onset population, younger children whose lives are impacted as well.
For someone who's newly diagnosed, what benefit is there to seeing you?
Well, I think that there's an overarching philosophy in Parkinson's care that early intervention amongst all team members is important. So whether it's social work, speech, occupational therapy, physiotherapy, nursing, just that idea of knowledge is king, so that if you can know a little bit more about each of those areas and what each of those people can do for you, that's going to help. So, specifically for me in social work, I often talk about communication within the family and how important it is to keep those lines of communication open and not wait until things build up and build up and build up. I like people to know about what some of the resources are out there. People become very worried for the future, and so part of that early intervention is thinking about things like advanced care planning, and that can be scary to some people who are newly diagnosed. They don't want to think about that, but in actual fact, whether we have a diagnosis or a health condition, we all should be thinking about advanced care planning. So it's talking to people about powers of attorney and representation agreements and wills, and really just having your ducks in a row, but also having those harder conversations about your wishes, your values, your beliefs. What would you want if you were unable to communicate yourself? So those are some of the conversations that I like to have with people early on in the condition, and I think that that's really helps them to manage their well-being. Self-management is another thing that I talk to people early on. So, what are the things that you can do for yourself to live well with Parkinson's disease? Medications are one thing, and that's great, but you need to remain socially active, you need to remain physically active, and intellectually engaged. So those three things are kind of make up that self-management model, and really encouraging people to to take that self-management role.
That can apply to anybody, really. Yeah. So I think that's the key message that I get from you, is that what you offer is actually something that applies to anybody, regardless of whether they have Parkinson's or not. Yeah. So really appreciate you making that much clearer for me, and hopefully for viewers of this program. Yeah. One thing that came to my mind was, for me, it was initially hard to accept that I had Parkinson's. Like on a surface level, I accepted it, but on a deeper level, I was having a hard time because I didn't really want to see anybody else with Parkinson's, because I didn't want to know I didn't want to find out how I might become, right? So that was something that I had to deal with, and it was only through like talking to friends and family and others that I overcame that. Yeah. So I think being much more aware of the service that you provide, I think, is really key for that I want to get across.
So what I think is really important about what you said, and which I hope other people would hear, is that idea, that process of how do you get to the place where you do kind of accept the diagnosis. And I don't love the word accept, because that's a pretty big word.
Yeah.
Nobody is going to put up their hand and say, woohoo, I've got Parkinson's and I'm so happy about it. But it's more about coming to terms with the condition and how it's going to impact your life. And it's about making accommodations in your life along the way. And so, but you said something pretty important about how you were slow to meet other people who have Parkinson's because you didn't want to see where it was going to. Some people take different directions with that, like through support groups. They may see people who are far more impacted by the condition, yet are living a very full and meaningful life. And so that can be very, very inspiring, as opposed to the opposite, where they see somebody who's pretty impacted by the condition, and are not doing anything with their lives.
Yeah.
So I think that trying to get people to connect with the right people for them can be very empowering and supportive. That, we don't want to really see anybody going through this by themselves.
Yeah.
There's no need to go through it by yourself.
Yeah. It wasn't until I actually connected with the Parkinson Society BC that I really started to see value of interacting with others with Parkinson's. Like going to the Parkinson's Congress in Portland really opened my eyes too. And so for me, going to that Congress was like, I call it Parkinson's Disneyland, because you feel free and just to be around others with Parkinson's and not feel like you're an outcast or something, right? So
Everybody understands.
yeah. So I think that's the important thing about getting involved with other people with Parkinson's. The community is I've never met such incredible people. So that's why I'm so much of an advocate now for people to get involved right away. Yeah. So, anything else that you'd like to share?
I think we hit, the important things around staying connected, staying engaged, the non-medicinal stuff. I think those are the highlights.
Great, thank you.
Okay.
Yeah.
Thank you.
Yeah, thank you.
Good luck with the project.
I appreciate that. Thank you. What's your role in this whole movement disorder clinic?
So my role here, I'm a member of sort of the bigger sort of multidisciplinary team. I'm the physiotherapist here in the movement disorders clinic. Really, I provide physiotherapy services to clients with Parkinson's and other movement disorders across the province. So I work on a consult basis and provide assessment, education, exercise programming, and really help with goal setting and sort of self-management sort of techniques.
How have you found working with Parkinson's patients?
It's inspiring. It's amazing. Sort of people, sort of, from all aspects, are sort of very determined, very diligent with activity and exercise, and really want to get sort of the most out of life and sort of do the best that they can to sort of manage their condition. So I learn so much from clients themselves. So they're, people often bring in different resources and different things that they're using. So yeah, it's great.
Have you run into any difficult cases?
That's a good question. Difficult in what way?
I guess challenging in terms of the, progression of the illness for that person.
Yeah, so I think it's always challenging when someone's having difficulties maybe with their movement or their function, and sort of that can occur with the progression of the condition. But I think it's trying to meet people where they're at and trying to sort of maximize and support them in the best way we can.
Yeah. I appreciate the help that you've given me.
Yeah, you're welcome.
Yeah. What would you tell someone who's newly diagnosed, the benefit of coming to see you right away?
So I think when someone's newly diagnosed, it's often quite overwhelming. I hear people say they've just had this diagnosis, and they're then researching and looking at information. So first of all, it's really to look for reliable resources in information there, and then to exercise and being active is sort of a key part of sort of the management of Parkinson's. So being able to connect with someone and sort of have an assessment specific to individual needs, I find can be really beneficial and just sort of help guide that sort of exercise programming. We have people that may already be exercising, and also people that may be new to exercise. And so again, everyone has different needs and goals that they're trying to achieve.
So, sorry, I lost my train of thought.
That's okay. So I think we talked about new diagnosis, and I mean, for me, seeing someone sort of specific with a specialization, with experience, I think it's important for people to connect with people with a good knowledge of Parkinson's, or people that have maybe sought further education and training, so that we can really sort of target any sort of symptom management or exercises to help with sort of, those individual needs.
How would you differ from just seeing a regular physiotherapist?
So sort of there's many aspects of physiotherapy. Sort of physiotherapy that people are probably more used to is if you have what we call a more musculoskeletal injury. So you may have some back pain or a knee injury. And so from a movement disorder or neurological perspective, we just have a different sort of perspective on movement, and again sort of have that extra training and education in Parkinson's and sort of symptoms that we'd expect to see, movement patterns that may change because of Parkinson's, especially movement can become much smaller, much slower, and so really being able to sort of to target that exercise sort of to those specific needs, and look at the person as a whole, as their sort of whole function, rather than sort of an individual component, if you like, which people may go to a sort of what you call a regular physio because they have elbow pain, so that physio would treat their elbow, whereas we may look at sort of that movement as a part of their whole body.
Yeah, that really helps for my audience to understand that. Thank you. What would you tell someone who's newly diagnosed?
Really, say first of all to just take a breath. It can be overwhelming. It's a lot to take on, but one of the key aspects is really giving that education, that information about the importance of exercise and activity. So I think it's well known for all of us out there that we should all be active and exercising, but particularly for people with Parkinson's, along with medication management, that it can be one of those tools to kind of help maximize function and the body's ability to kind of keep strong and keep moving. So it's really trying to build those good habits early on, and then creating a sort of consistency. It's not one of those things where you're going to exercise for a few weeks and it's going to go away. It's kind of building that lifelong kind of habit, and sort of having ways to be accountable, having ways to sort of make it a little bit more exciting or motivating. So you may have you may exercise with a buddy or people with family. So it's really sort of seeking out that support, sort of understanding what works best for you. We're all individuals, and we're not sort of, what may work for one person might not work for another. And as much as there are some exercises that are particularly important for people with Parkinson's, really ultimately it's finding something that you enjoy, that you're going to keep that consistency and sort of lifelong sort of work with.
Yeah, in the summer, last summer, I ended up playing ball hockey with my friends pretty consistently throughout the summer, even when it was super hot. I can't believe that we actually played. But
you've got to keep hydrated.
Yeah, we did stay hydrated. Yeah,
but that's it. It's like interacting with friends and family can just make it a little bit more exciting.
Yeah.
It's just less tedious.
Yeah, exactly.
Sort of in the sort of exercise regime.
Well, that's all I have to ask. So thank you. Yeah.
No, you're welcome. It's been great.
Thank you very much. Appreciate it.
Thank you.